So this is your Foley catheter. This is for urine. So usually if they have kidney issues or they're not able to go on their own, they will give them a Foley. Or if they've done surgery in there and they need the bladder to rest or the kidneys to rest a little bit and not have to worry about it, they will use this. Normally, this is when they're in bed, it's going to go on the side of their bed. You never want to put it on something that moves like this or this. You don't want to hook it there, because if you accidentally forget that it's there and you move it up, then you can yank that Foley out also. And if these move up and down, then that can tug on that Foley. So you don't want to do that. It's going to hang right up in here. If they're in their wheelchair, it'll hang on the sides of their wheelchair like that. I'm going to bring it up here so I can show you what the steps are to draining it. Because we cannot change these, but we can drain them. You cannot change the bag at all. Some of them may ask you if you could go from a leg bag to, I call it a purse bag, but you cannot. This does not want to touch the floor also. So you're going to put a barrier down, whether it be a towel, washcloth, paper towels, whatever the family uses to drain it. Sometimes they'll have a basin just for this that they will use. So before you drain it, you want to get your measurements. And then you can just pick up the tubing a little bit and the rest of it will go in there. However, I don't like it to get over 1200 because it tends to pull on the Foley catheter, and we do not want to pull that out because then that's a hospital visit to get it reinserted. So we don't want to do that. So you want to get your measurements. You're also looking for cloudiness, whether the color is normal urine color or dark. And you're also looking for any sediment in there, because that can mean a stone is breaking up or calcification on the inside of the bladder. So we need to know those little things because other things might be going on with that patient. So we're looking for urine that you can see through and that light amberish color. Nothing dark. Dark can indicate not enough fluid or blood. So you got your catheter. You'll get your receptacle, whatever they use. We have a graduated cylinder, but they probably won't have one unless they have a urinal, which is great to drain the catheter in because then it has the measurements right on the side. A lot of them will be just a butter dish or a bowl or something like that that they use to drain their urine. So once you, and always wear gloves. So you're going to take it out. You're going to put it directly over your cup, but you will not touch the sides of that cup because then you're going to pick up bacteria. And then you're going to push this forward. Push it forward. It'll drain out. Once it all comes through, you want to close that back again. And then you're going to have 2 alcohol swabs waiting. 1 alcohol swab is to clean the outside and inside of that tubing. The second alcohol swab is to clean the inside and around here, and then you're going to put clean back into clean, and then you're going to take your urine and you're going to dump it. So that is how you do the Foley. The next part of this is you're going to have to clean the tubing. So here's your tubing. This part is inside the patient. So here's the bladder. This sticks in like this. The nurse, when she inserts the Foley, she will put 10 milliliters of water in here, and that holds the catheter in place into the bladder, so it's not so easily pulled. So that is inside the patient. You're going to get a washcloth of warm soapy water, and you're going to fold it to where it makes 4s. And you're also going to get a cloth with no soap on it, so you can either put a little soap on each corner if you choose. But you have to use the 4 corners because you need a clean side with every swipe of the catheter. So to clean this for patients with a catheter, you take 1 corner, swipe it down, fold that one back. Take the second corner, swipe it down. And you continue to do that through all 4 corners, and then you get a clean washcloth to rinse, and you do the same things. So that is how you clean the tubing that's inserted into the body and how you drain a catheter.